In this first presentation, we're going to begin by focusing the spotlight on men's health and asking the pertinent question about what we mean by men's health. Three approaches to defining men's health can be identified in the literature. The first is popular men's health and media portrayals of men's health and the messages that we receive about men's health through those portrayals. The second looks at men's health from an inequalities perspective, and the third looks at men's health through the lens of masculinities. For this particular presentation, I'm going to hone in on the first two definitions of men's health, and the third definition around men and masculinities will be explored in greater detail in the second module for this training. You may recognize some of the images here as the popular portrayal of what a healthy man ought to look like in our popular media. These images depict the idealized version of the masculine form. It draws on discourses of hegemonic masculinity, which I will explore in greater detail in the second module. On balance, these images represent a rather narrow view of men's health, focusing in particular on strategies to improve physical attractiveness and physical prowess or performance. And notably, these idealized images are not images that most normal healthy men would relate to, and these images can often set an expectation of what a healthy man ought to look like. The portrayal of men's health in the popular media has proliferated since the 1970s, so that today we have men's health magazines, we have guidebooks targeting men themselves, we also have medical guides to men's health. All of these resources, so to speak, promote the privatization of health. So in other words, they promote men looking after themselves, rejecting traditional models and systems of support around their own health, which can feed in to the hegemonic masculine ideal of being independent and ultimately can have a negative impact on men's health for a number of reasons. Here you can see in a study by Crawshaw in 2007 that popular media portrayals of men's health promote the privatization of risk management as the responsibility of self-regulating, health-seeking citizens who essentially become experts in the management of their own health. In other words, it places the responsibility of health solely at the foot of individual men, and if they do not take this responsibility, they are not seen to be responsible citizens, and it also places an expectation on them to become experts in the management of their own health, which is a really, really high bar to set for any individual man who may need support. Also, it does not in any way recognize the fact that any individual's health is affected by a number of social determinants beyond the control of the individual. And by raising the expectation of men to self-regulate and to be experts, this can often manifest in self-medication through the internet. And this can have two potentially serious consequences for men. First of all, by being the expert of their own health and not seeking help from health professionals, they may miss out on having an underlying problem diagnosed. And a clear example of this is erectile dysfunction. Erectile dysfunction may be a symptom for many men of a larger cardiovascular issue, and by only treating the symptom, the actual major cause, which is the cardiovascular risk, would go undiagnosed. And also, we also know through evidence in the media and elsewhere that men who seek to self-medicate through the internet are also vulnerable to the risk of potentially dangerous counterfeit drugs, both in terms of the substances within those drugs, but also the dosage, etc., that a health professional is required to inform patients about. So overall, with respect to how men's health is defined in the popular press, it can have long-term damaging effects for men who have an expectation of achieving an unrealistic, idealized body image, but also an expectation of themselves to be experts in their own health, which again is simply unachievable for most ordinary citizens. The second way to define men's health, which I will spend most of this presentation looking at, is through the inequalities lens. In the last 20 years, a considerable body of evidence has been generated that consistently shows that across Western cultures, men die far too soon and suffer unnecessarily because of taking too many risks with their health, delaying going to the doctor when they have a problem, and also by being offered very frequently health services that do not meet their needs. We know that in Canada, poor lifestyle behaviours account for 70% of men's higher mortality rates for chronic diseases. And the first study on Irish data was published in 2001 by the Institute of Public Health in Ireland. And at that time, it was concluded that on the island of Ireland, the excess mortality amongst males represented a fundamental inequality in health. What I will present over the next number of slides is data across Europe that was published in the European Men's Health Report. And what I would like for you to consider as you are listening to my presentation, but also looking at the slides that I'm showing, is that there is no biological reason that can account for the differences in mortality and morbidity rates that will be presented here. In this slide, you can see the life expectancy at birth by sex and country across the 27 EU member states. The two key messages that I would like for you to take from this slide is that across all countries, men have a lower life expectancy at birth than their female counterparts. The second thing I would like for you to note is that male life expectancy is also inconsistent across the 27 EU countries. And as we move more towards the right of this chart, you will see that the life expectancy for men drops considerably. So on the extreme right-hand side, men are only living to about 67 years of age, whereas if we move to the extreme left-hand side, men in these countries live to approximately 80 years of age, representing a 13-year age gap in life expectancy between men across Europe. So this isn't simply a case of a male versus female argument in terms of inequity. Within the group that we define as male, there is also a considerable difference that is predominantly defined by social class, whereby men in the poorest countries can experience lower life expectancy and lower poorer health outcomes than their wealthier counterparts within their country and in other countries in Europe. This slide shows us the sex ratio of rates of death for all conditions by age and country. So effectively, the male to female ratio of deaths can be potentially up to 3.5 times, depending on the country and the age. The one consistent thing that we can see across the countries here is that men aged 15 to 44 years have a higher death rate ratio than any other age group. And again, this cannot be accounted for by biological reasons. And this slide just says a little bit about the Irish story. Here it shows the number of deaths by age and sex in the Republic of Ireland. And as we can see, from 15 years of age up to 65 years of age, men are more likely to die than women. And as you can see, there's an exponential increase with a curve beginning around 40 years of age. So while we know that men are more likely to die at all age groups, in particular the 15 to 44 age groups across Europe, what are men dying from? In this slide, you'll see on the right-hand side a graph of the death rate for women for selected causes from 15 to 50 years of age. So with the exception of malignant cancer, the death rate is relatively stable across all age groups for all the other causes of death. There's an exponential rise around the 30-year mark for women in terms of death from malignant cancer. If we look to the left-hand side, you can see the story is quite different for men. So similar for women, there's an exponential rise in deaths by age in malignant cancer. However, if we look at ischemic heart disease, it is somewhat similar to the cancer pattern. And notably, if you look at the orange line, there is a steady increase in the rate of suicide among men across the 15 to 50-year-old age group. And also, it's worth noting that there appears to be a peak in traffic accidents around the 20-year mark for men. So this would tell us the story in terms of what men are dying from and what some of the issues are with respect to improving men's health from a public health perspective. And in the next couple of slides, I just want to hone in on a couple of specific causes of death. And here you can look at the standardized death rate for accidents by sex and country. And again, it's clearly evident that men are considerably more likely to die from accidents in every country across the EU member states. Notably, those countries with the higher death rates are often the more industrialized countries where men may work in more dangerous workplaces that could contribute to the statistics you're looking at here. But please remember that I've never come across any literature that states that men are biologically more accident prone. So in order to address these alarming statistics here with respect to male fatalities due to accidents, we need to understand what might be underpinning the reasons for these accidents. And again, it's a similar story for deaths due to injuries. Here we can see that in some European countries, men are over 4 times more likely to die due to an injury when compared to their female counterparts. And likewise, across all age groups in the EU 27 countries, men are more likely to die due to drug dependence and toxicomania. And notably, there appears to be a curve with respect to an increase in death rate up to the age of 35 years of age, thereafter decreasing. So obviously, drug dependence and toxicomania is a greater issue for younger men, particularly as they are around the 25 to 45 year age group. And again, just to share a little bit of the Irish story specifically, this is data that was published in the first National Men's Health Policy back in 2009. And what you're looking at here is a mortality ratio. Effectively, anything above the number 1 would indicate that men are more likely to die of this specific condition. And as you can see in Ireland, for all of the causes of death on the right-hand side of the slide here, men are more likely to die across all age groups. And of particular note is the marked increase in deaths due to external causes of injury and poisoning that happens again in around the 20-24 year age group. And in this category, we'd be looking at road traffic accidents, and also look at that blue line of that marked increase in deaths due to mental and behavioural disorders. And again, amongst the 30 to 35 year age group, there our suicide stats would be represented here. And again, you're looking at data from Ireland here, and what this slide represents is the incidence and mortality rates of specific cancers that affect men and women. And anything higher than the black line across represents a greater incidence and a greater mortality rate of cancers for men. And what I'd really like to highlight here is the melanoma statistic. So effectively, fewer men in Ireland are diagnosed with melanoma than women. However, more men die from melanoma in Ireland than women. And I think this says a lot about men's presentation at the doctor. So possibly men present at a later stage in the development of the cancer than women do, and therefore their prognosis is worse. But also it might tell us something about what happens for men post-diagnosis in terms of their treatment and their adherence to that particular treatment. But again, I think it's noteworthy that there is something happening for men with respect to their diagnosis and treatment of this form of cancer that effectively reduces their chance of survival. I think it's evident from the data that I've presented so far that a clear inequality in health exists in mortality statistics, not just between the sexes, but also between different categories of men, whereby the poorest men in societies across Europe have a poorer health than the richest men, but also this is also true between countries. What I'd like to look at now for the next few slides are the morbidity statistics that we know around men's health. And the first condition I'd like to look at is obesity. Of particular concern when it comes to obesity is that men tend to accumulate fat around their abdomen, which increases their prevalence of metabolic syndrome. So effectively, when men gain weight, they tend to develop an apple shape rather than the pear shape that women tend to develop when they gain weight. And men, as a result of where they carry their weight, they are more likely to develop metabolic syndrome. And as some of you may know, this is a condition that directly relates to mortality due to circulatory disease, many cancers, and respiratory disease. And since 1990, the prevalence of obesity among men in Ireland has increased considerably. It has tripled since 1990, and female obesity has not increased to the same degree. So currently there are more male men who are obese than women who are obese in Ireland, and the latest stats show that only 30% in Ireland of men in Ireland are currently of normal weight, which obviously is concerning given where they carry that weight and the relationship between the development of obesity and metabolic syndrome. And when we look at European data about the percentage of people who are overweight by sex and educational attainment, it is clear from the data presented here that as women move further up in education, so in other words, those women who have post-secondary or tertiary education, they are less likely to be overweight. However, a similar pattern does not exist for men. So in other words, irrespective of educational attainment, men are equally likely to gain weight. So therefore, overweight and presumably obesity is not dependent on educational status. And the second morbidity stat and last that I'd like to present here is around chronic liver disease. And again, all of the blue lines across all 27 countries are higher for males than they are for females, which effectively tell us that more men are dying from chronic liver disease than are women, which again would indicate the problem drinking among men and its impact on their health. However, inequalities don't just exist in morbidity and mortality stats. When you look at this slide here, While men are equally as knowledgeable as women in terms of the need to eat a variety of different foods, they seem to be particularly less knowledgeable about what types of foods they should be eating. In other words, men are less likely to know to avoid or to not to eat much fatty food, and they're also less likely to know about the importance of eating fruit and vegetables. And I think this is really important if we are to begin to consider as practitioners about how to address some of the statistics that I've shown you earlier in this presentation. However, the news is not all bad. As you can see here, when asked how often you exercise or play sport across all age groups in Europe, men are more likely to be regularly active than their female counterparts. So this appears to be the one health-related behavior that men find more easily or perhaps socially acceptable to do, and would therefore indicate that it is definitely a vehicle which practitioners can use to support them to improve their health and address some of the health outcomes that you have seen in this presentation so far. And before I move on from this particular definition of men's health, I would like to leave you with a couple of key messages, which are, according to mortality and morbidity stats, there is an inequality in health that men experience that cannot be accounted for by biological factors. There also appears and is a between men inequality in health as well, whereby men from lower income countries and lower socioeconomic groups fare worse than their wealthier counterparts. There appears to be a knowledge deficit that men have with respect to health-related behaviours, which may impact upon some of these statistics. And also, we know that physical activity appears to be a health-related behaviour that men engage in more frequently than women. Again, a useful piece of information to hold on to as health practitioners who are trying to address some of these issues of men's health and reduce the inequalities seen here.